All right. Good evening, my lovely people. I hope that you are doing well wherever you are. It's me again, Ishmael Mbithi. I'm coming live to bring good news of Mtumishi Ishmael Volunteer Health Talks, MIVHT. We have been doing these health talks for a while now, and I hope you are familiar with what we do. The previous video that I did was about pelvic inflammatory disease, and today I wish to continue with a similar condition, a gynecological condition that affects our women of reproductive age. So today, allow me to talk about this condition called polycystic ovarian disease, or rather, polycystic ovarian syndrome, PCOS. PCOS, that is the abbreviation of this disease. So it's very interesting. It's a very interesting disease, and I hope that you are going to like it. So before we continue, if you are new to this channel, kindly make a point of subscribing, like our videos, share this message, share this video with your friends so that they may also know about these conditions. So PCOS, polycystic ovarian disease. As I've said, this is one of the gynecological conditions that affects our women, and I thought it is wise to come live again and break it down so that we may understand. So polycystic ovarian syndrome is a disease that affects the ovaries. As the name suggests, polycystic ovarian syndrome, it means it is a disease that affects the ovaries. The first word is polycystic. You can break down the word polycystic to poly and cystic. Poly means many. Cystic means cysts. Cysts are fluid-filled sacs that are present in the ovaries. So poly means many. So in this disease, we'll have so many fluid-filled sacs in the ovaries. And these cysts will have several symptoms, which I'm going to discuss. And I believe that we are going to understand it better. So polycystic ovarian syndrome will manifest with these features. Okay, let me first say this. For ovulation to occur, ovulation is that process whereby after every month, depending on the length of your menstrual cycle, I mean the length of menstrual cycle of a woman of reproductive age. Remember, I said that a normal menstrual cycle should be between 21 and 35 days. So, depending on the length of the menstrual cycle, a woman will have to release a mature ovum at the end of the menstrual cycle. Let's say after 21 days, let's say after 28 days, let's say after 30 days, 35. So for the ovulation to occur, there are processes that must occur in the ovaries so that this mature ovum can be released. And this process is called ovulation. So we have follicles in the ovaries. Follicles are those small cells that will grow and release a mature ovum. So we have follicles around the ovaries, and they are responsible for ovulation. How? They mature and release that mature ovum, which is then transported to the oviduct, and when it meets with the sperm, then fertilization occurs. But if there is no fertilization, then the process of menstruation continues. So this polycystic ovarian syndrome will have these features, but I thought of including this ovulation to elaborate something. So in a normal ovary, we will have follicles which are very normal. But for polycystic ovarian syndrome, these follicles will have fake follicles. Let me call them fake, because they will never mature. They will never grow. They will never be able to be released for ovulation. So we will have so many fake follicles on the margins of the ovary. What I mean is on the outer part of the ovary, the lining of the ovary. We will have so many of them attached there, the marginal area. And these fake follicles will have fluid inside them. So because they have the fluid, they will never grow. They will never mature. They will never be released for ovulation. So for polycystic ovarian syndrome, we'll have these features. One, we'll have presence of fake follicles in the ovaries. Number two, the fake follicles hardly mature. They never mature. And if they mature, it may take a long time. That's why you'll see many women will miss their periods. The periods will become irregular because of the follicles are not maturing. They will never grow. They will never be able to be released. And again, the cysts that are in the follicles may be filled with fluids, may have gases, and may have solids. So these are some of the features of polycystic ovarian syndrome. Just understand it that way, that the follicles that are there are fake. They will never mature. They will never grow. They will never be released. Now, I want to discuss about the causes. The causes, what causes this disease? Now, scientists have not been able to come up with a clear cause of this. I will say the cause is idiopathic. Idiopathic means the cause is not clearly known. The cause of this disease is idiopathic, meaning the cause is not clearly known. But again, there are factors that are associated with PCOS, polycystic ovarian syndrome. Number one, it is what we call elevated levels of androgens. Elevated levels of androgens. Androgens are male hormones. Let me clarify this. Every woman has some levels of male hormones, and every man has some levels of female hormones. Like, if I am a man, I have some hormones from the other gender. I have some female hormones in me. And for a woman, the woman will have some male hormones in them. But for this particular condition, PCOS, you will have you will have elevated levels of male hormones. Normally, the male hormones in females should be very minimal. They should be very low. They should not be greater than the female hormones. So for this case, for PCOS, for polycystic ovarian syndrome, you'll find that the male hormones are very, very elevated. And precisely, male hormones called testosterone. So for a woman with PCOS, you'll find that the levels of testosterone are very high. So the other cause will be obesity. Obesity is being overweight. Why? When you have a lot of fat in your system, you will have some problems with insulin sensitivity, and this can increase the chances of the hormones being overproduced. The other cause could be genetics. What is genetics? I just want to use the simplest terms possible. Genetics is whereby if in your family, one of your family members, maybe your mom, maybe your sister, your cousin, has ever had this PCOS, then you are highly predisposed to PCOS. Like it is something that is in your family, in your bloodline. So genetics play a role in this. The other cause could be insulin resistance. Insulin resistance. Insulin is the hormone in the body that regulates the blood sugar. Insulin is produced by pancreas, and it is responsible for regulating blood sugar. So when there is insulin resistance, the ovaries can be stimulated, because when there is insulin resistance, it means we will have elevated sugar levels. And these elevated sugar levels and the insulin can stimulate the ovaries and start overproducing what? The male androgens, the male testosterone. Now, I want to discuss about the symptoms. How would you know that a person, a woman, has this disease called polycystic ovarian disease? Now, the symptoms are very common, but we have a criteria of ruling out if a woman really has this disease. We have a criteria called Rotterdam. So we have Rotterdam's criteria that is used to rule out if a woman has PCOS. Rotterdam is a place where some scientists met in the year 2003, and they came and discussed about this disease PCOS, and they were able to come up with this criteria that can be used to know whether a woman has PCOS. Now, they discussed about three things, but they said a woman will be diagnosed with PCOS if she has two of these three symptoms. I want you to understand me very well. Like they said, we have three major symptoms of this disease, but if a woman has either of the two of the three symptoms, then she will be diagnosed with polycystic ovarian disease. Now, symptom number one is the irregularity of menses. Irregularity of menses is whereby the menses have become very irregular. A woman can miss periods for a month, 2 months, years, or forever. Because we said the fake follicles in the ovaries may fail. They may never mature and produce that ovum. So, number one symptom is when menses have become irregular. Like you menstruate this month, you wait the next month, you don't menstruate, you wait for another month, nothing is coming out. You can menstruate after 5 months or 8 months, something like that. Mostly for women with PCOS, they will have less than 8 periods per year. So they may have 7 periods, 6 or less, or even 1 or none. So irregularity of menses is number one symptom. Number two symptom is elevated levels of male hormones. Elevated levels of male hormones in the woman's system. And this can be manifested by a woman who has PCOS will have symptoms like what we call hirsutism. Hirsutism is whereby a woman has a lot of hair. She may also have some beards because of the presence of these male hormones. So a woman may have excessive hair on the chin, on the hands, everywhere on the chest. So that growth, excessive growth of male hair. Number two, may have a lot of pimples on the face, what we call the acne. So a woman with PCOS will have many pimples on the face or around the body. Now, number three is what we call the male pattern baldness. The male pattern baldness is loss of hair around your face, just the way these men, other men, may not have some hair. So male pattern baldness is also a symptom of elevated levels of male hormones, what we are calling the testosterone. And number three, we said the Rotterdam criteria as three. Number one, we said irregular periods. Number two, we have said elevated levels of male hormones. And number three is through ultrasound. So when we do an ultrasound of the ovaries, we may have polycystic ovaries. So if a woman has polycystic ovaries, when an ultrasound is done, then it is an indication of, it's an indication of PCOS. So a woman will have these PCOS if she has two of the said symptoms. I want to talk about the treatment. The treatment is basically, as we said, we don't know the exact cause of polycystic ovarian disease, and so we may not have exact method of treatment. And again, I want to clarify this. The symptoms that I've said there, they don't occur to every woman. There are some women who will lack those symptoms, but they may have the PCOS, but they don't have the symptoms. So the symptoms may vary. So we said we don't have exact cause of this disease, and so we don't have an exact method of treatment. But the first thing that you are supposed to do is to make sure you do what we call lifestyle modification, because this disease is purely lifestyle. So how can you modify your lifestyle? Make sure you eat a good diet and practice regularly. So you should have some good diet and exercise, because healthy eating and regular physical activity can improve what? The insulin sensitivity. Because we said when insulin is present, can stimulate the ovaries to overproduce male hormones. So you can have lifestyle modification through diet and physical exercise. The next thing here is weight management. Make sure you cut your weight. Make sure you go for those gym to cut your weight, because we said obesity is one of the causes. When you have a lot of fat in your body, this is a risk factor for PCOS. So those are some of the things you can do to modify your lifestyle. Now I want to mention some form of medications that you can use to manage the symptoms, because we have said we don't have exact form of treatment. So you can do some medications. For example, we have progestin therapy. Progestin therapy is whereby you use medications that contain this hormone called progestin, and this progestin they will regulate your menstrual cycle. So progestin therapy is one of the measures that you can do to manage the symptoms of PCOS. The other drug that you can use in case you have insulin sensitivity, resistance, you can take a drug called metformin. Metformin is a drug that will regulate your menstrual cycle and also improve insulin sensitivity. So the insulin will be able, okay, what we mean by insulin sensitivity is the receptors in your body should be able to absorb the insulin. So when you take metformin, it will improve your insulin sensitivity. The other drug is called inositol. Inositol is a drug that is taken to do what we call the supplement. It's a dietary supplement. So it is known to improve also insulin sensitivity, and it also regulates menstrual cycle. So inositol is a good drug that can be prescribed by your physician, and you can take it. The other thing about PCOS, you can do what we call fertility treatment, because by the way, when you don't menstruate, it means you will never have fertilization. So PCOS can cause infertility. So you can do fertility treatment by, you can take some medication, for example, clomiphene and letrozole. These are some of the medications that you can use to stimulate your ovaries and cause ovulation. So for them that want to conceive, for the women who want to conceive and have children, you can stimulate your ovaries to bring about ovulation using clomiphene and letrozole. These are some of the medications that you can use to stimulate your ovaries. Lastly, but not the least, about fertility, you can do what we call IVF, in vitro fertilization. This is a technology that you can explore if you want to conceive and have children. Therefore, I just want to summarize and say this disease is purely lifestyle. And therefore, if you want to manage it, make sure you cut weight, make sure you practice, you do some exercise regularly, make sure that you have managed your weight very well. And if you see some of these symptoms, you can visit a gynecologist, a physician, and he or she will be able to prescribe the best medication for you. So if it is you are seeing a lot of acne in your face, there are medications that you can use to manage the symptoms. If you are not ovulating, you can use the progestin therapy. You can use if you want to conceive, you can use clomiphene and letrozole, and you'll have fertilization. So that is all about PCOS. It is a very sensitive disease, and if untreated, it can cause infertility. The couples that have experienced this can tell the story. It's not a good one, but the best thing is it can be managed. Therefore, it's good to be sensitized about it. And kindly, if you have a question or clarification, you can always ask on the comment section. This is courtesy of MIVHT, Mtumishi Ishmael, Volunteer Health Talks. As I promised, we'll be bringing to you such a kind of talks. For now, bye-bye, and God bless you.